Oh, tell me, my Leilani. Hello, everyone. Good afternoon, good morning, good evening, depending on where you're watching from. Today we have a really great guest. We're going to be talking about breastfeeding. It's Leilani Songer. She's with us today. So welcome. We're so happy to have you here.
Thank you. Thank you, Chris. It's good to be invited in.
Nice, nice. Okay, so hey, before we get kind of into the juicy stuff, do you have any projects or any like passionate things you're working on this year that you want to share with the audience?
Oh, wow. Yeah, a lot of things that I'm working on. Currently, I opened up a wellness center and I'm gathering people that can come in and serve our families. I'm also working on a new product called microcurrent neurofeedback for our practice, which helps every person for all sorts of things like anxiety, depression, chronic pain, people that are suffering with cancer. It helps with the symptoms, people that are having addiction problems or ADD or ADHD. And this system is 85% effective with the first treatment, and it's really amazing. Even the government is involved now. They are putting together this grant to serve the military because they have their PTSD and the major trauma. And then, so anyways, it's really exciting. I'm super happy about that I can help so many different people in so many different ways.
Right? That sounds fascinating.
Yeah.
Cool. All right. So let's talk about maybe the first time mom, she's pregnant, she's getting ready to deliver. What are some breastfeeding tips and tricks that you think are pretty common for women to know?
Before she gives birth, getting some education is really important. I know that they teach some basic breastfeeding classes in the hospital, but most of the time they're already exhausted. They're already overwhelmed with having a new baby, and they're being told, this is how we do it, and then go home, right? And so when they're in the hospital, already they're under a lot of stress. So I always recommend, if you can, go sit in at a breastfeeding support group or go sit with a lactation consultant one-on-one, kind of have the mom and the practitioner look at their history and take a look at their breasts and see if there's any complications that might come about. Knowing more in advance will help each mom. And also they can kind of walk through how to even latch, before they even have the baby. They can kind of role model it and explain it. And it really kind of helps take some of the level of anxiety or fear, that moms have, because they all hear, oh, breastfeeding is going to hurt. And it's not supposed to hurt. So we want to help moms understand that there is an answer to every question they have. And that's what I do, is I educate moms, set them up for success.
Right. And it's so heartbreaking when I teach my breastfeeding classes, it's like they really are anticipating that it's going to be painful, and they've heard horror stories and why is it when everyone's pregnant, everyone goes, oh, let me tell you what happened to me, and they want to tell you their worst stories. So I just think it's really important for women to go in with a really positive mindset that this is going to be not, I wouldn't say easy out of the gate, but the learning curve for breastfeeding, right? It's like it's difficult, and it gets much easier. Like if you can feed your baby half asleep, that's a pretty good deal, right?
For sure. I think the biggest thing is that we set ourselves up for potential disaster because we don't have enough information to start with. And when we come prepared, like anything in life, when we come prepared, we have such a better sense of peace about it, and we're able to walk into something new and brand new with a little bit of knowledge. A little bit of knowledge goes a long ways when you're starting out as a new mom. And like you mentioned earlier, a lot of people will start giving unsolicited advice, right, about pregnancy, how their delivery went, and how breastfeeding is. Or when you get past that stage and you see toddlers, you start giving unsolicited advice to people that have, toddlers, like, oh boy, expect the terrible twos, right? And it doesn't have to be like that. So set people up in advance for worries and, things that are not necessary. So.
Right. And I think that's such a great point. It's not necessary. Like, with my first son, I didn't do my due diligence. I didn't get the education. I grew up in a big family, and I remember my mom breastfeeding my sisters, and it just was something in my head that was just going to happen, and I didn't really have that burden of false information going in. And I think that's a really good headspace to be in.
Right, right. And I know that we're moving in this forward direction with more people breastfeeding. So I believe that the next generation or two are going to grow up knowing that breastfeeding is normal, and you can breastfeed in public, and there's help and there's support, and everyone's going to understand that if there's something wrong, it's not necessarily that it can't be fixed. There's always an answer for every problem that you might experience. And so that's my passion, is to help moms look at what they're experiencing, and whether baby or whether it's mom, or if it's a combination of the two. And just sometimes those little tiny tweaks is all it needs. Sometimes, like in our practice specifically, we work with moms that have tongue-tied babies or lip-tied babies, and we resolve that. So we do releases in our practice, and then I teach moms how to breastfeed with the new latch, because babies, when they get released, all of a sudden they're like, wow, my tongue is working differently. Let's show me how to do it, because they have some habits that they've been using from day one of latch, and mom's been using her technique to balance out what baby's trying to do, and now they both have a new set of skills. And I like to teach them how to do it. And then I always tell moms, on that first day of that release from the tongue tie or lip tie, I always say it's day one of life. I say, we get to start from scratch as if you just gave birth. And now let me show you how to line baby up. Let me show you how to ask for a wide mouth. Let me show you how baby is transferring. And if the baby is transferring, this is what it sounds like. So that they get a better, clear understanding of what it's supposed to be. And then they just take off, and they move in such a wonderful forward direction. And I'm always like, yay, for them. I'm like their big cheerleader, It's great.
Yeah, that is great. So for those that don't know, can you elaborate a little bit on what tongue-tied is, what does release mean, and what's transfer?
Sure. Perfect. Okay. So when we have a tongue tie, most people don't even realize, like even as an adult, we don't even realize we have a tongue tie, because we recognize we grow up in our bodies, and we just think this is a normal way our body feels. But let me explain to you. Underneath the tongue, there's a frenulum. We all have them, but the frenulum is, if it's restricted, it's because it's too short or too tight. It makes the tongue unable to undulate. As the baby is transferring at the bottle, the tongue has to operate in a motion like this. So it rolls towards the breast, it pulls the milk out, then the baby fills the mouth up and swallows. If the baby can't do it, mom will often hear people say, well, your baby's not gaining enough weight, you need to supplement. Or you might say the nipples actually hurt and there's pain from the latch. And that's when I always say, if there's pain, there's a problem.
Right.
Or maybe the baby just says, or mom thinks baby says, I don't really like being here at the breast. This is really hard. And they just cry and cry and cry. And then mom gives the baby a bottle, and then they're like, oh, the baby must not like me because it likes the bottle and it stops crying. But that's not it. So when the inability for that tongue to function the way it's supposed to function, it's not all about, can the baby stick the tongue out? It's about, how does the tongue operate? Can it move laterally? Can it move, up and down? Can it go out and undulate and actually extract milk? So transferring, the question is, how is my baby transferring milk? We're listening for the suck and swallow, the pattern of the suck and swallow, and how effective it is. A lot of times I'll tell moms it sounds like this: suck, swallow, or suck, suck. That's when the body is having a letdown and the milk is flowing fast and the baby's just gulping and gulping and gulping. And then they may pause for like 5 seconds and then they start gulping. And then it slows down to a suck, suck, swallow, suck, swallow, suck, suck, swallow. It kind of goes in and out of a pattern. That's a good transfer without pain, right?
Right.
If the baby is not transferring, it'll sound like this: suck, 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 swallow. Suck, 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 swallow. And what they're actually doing is swallowing their saliva. They're not transferring milk.
Right.
So I teach moms how to listen, how to observe, and then how does the breast feel afterwards. So it's a bit of a small detail, but a big result. So that's what
Right. So what do we see when babies doing that? What are some signs we look for, right? Some stuff here and some stuff back here.
we're looking for some movement. We're looking for underneath the chin. You'll actually see some motion, some rolling motion underneath the chin. You'll also see as the baby is sucking, they'll be like suck, suck, suck. And then their chin just drops just a little bit farther. It's a slight pause and you hear that sound. That's one of the things. So you're looking suck, suck, swallow, suck, swallow. So it kind of goes in a pattern like that. You'll also see movement up into the jaw. You'll see it up into the ear. But babies can move if they're locked inside their head. There's like sometimes there's muscles or bones or restriction that's going on in their upper part of their jaw, even up in the front of their forehead. I mean, there can be some restrictions that you may not see all this movement happening. So you have to look for other things. Just because you see a baby's mouth move doesn't mean they're transferring.
Right, right.
Right. And so if a baby is able to suck and swallow in a good pattern, they feel well satisfied. In other words, can they go 2.5 to 3 hours in between feeds, and they feed well at the breast, then we know that they're doing a pretty good job of transfer. But we're also looking for pees and poos. How many pees and poos do they have in the 24-hour period? Super important. So working with a lactation consultant can help educate you in advance on what to look for. And also, after you get home from having your baby, or if you're a mom that was able to have a home birth, when your supply increases, which is somewhere between day 3 and day 5 for most moms, your volume of milk comes up higher. Your baby needs larger volume transfer. And so you'll notice that, from day 1 to day 3, usually the babies are pretty sustainable. In other words, they don't take a lot of milk. So if you happen to start off with a high volume of colostrum, which is the early milk, the concentrated milk. If you have a high volume, then the babies generally are pretty satisfied until the milk volume starts to increase, and then moms start to feel engorgement. And when the baby goes to the breast and is not able to transfer that milk out or remove the milk out at the breast, then moms are feeling still engorged. And then the babies are frustrated, or they're super sleepy, or there's these different signs that moms will notice that something's not right. So usually we get the phone call right around day 3, day 5, like, I don't know what's going on, but my baby's crying all the time, or my baby is such a good baby, sleeping all the time.
That's not a good sign, is it?
Not a good sign. Not if they're not eating well. Because sometimes I say, well, when did you feed your baby last? Oh, it was about 6 hours ago. He's really not hungry. And I'm like, oh, that's a red flag.
Yeah. It's so alarming when moms say, oh, my baby slept through the night at 2 weeks, 3 weeks old. It's like, oh my gosh, that's not supposed to be happening. Like that's very scary for babies.
Yeah. And there's so much to understand, but some real basic things. If you just know the basic things, it will certainly help you understand and look for the red flags.
Right. Can we talk a little bit about cluster feeding and what to look for and what it is and how to deal with it?
Yes. So cluster feeding, often you'll see that at the second day of life. So day 2, they will do frequent feeding, which will be somewhere between every hour to every 2 hours. What they're trying to do is bring your milk supply in. Mm-hmm. So they're trying to increase the volume. So as the meconium leaves the body, which is the thick, tarry, sticky poop, you'll recognize that. As that starts to leave, that's the sign that the baby's belly is getting hungrier because it's emptying out. It's like, I tell moms, like if you ate a big, heavy Thanksgiving dinner and you walked away from the table and your tummy was really, really full, that's how they feel when they're born. They feel full because their body is filled with meconium. And so as they start getting the colostrum, mm-hmm. the meconium leaves their body, starts to turn to like a dark brown, then a green, then a yellow. But that's a sign that your milk has increased in volume. And so what the baby has done is send a signal to the body, I need more milk. So they spend more time at the breast. So as everything is working in a nice rhythm, so your volume goes up, the poop starts going up too. So that's one of the growth spurts you might notice, or so we call like frequent nursing. That should last to about day 3.
Right.
Day 3, then all of a sudden babies will start to eat every 2.5 to 3 hours. That's considered normal. Then somewhere around 2 weeks of age, just when you think you've mastered breastfeeding, right?
Yeah.
You mastered breastfeeding, then all of a sudden baby's wanting to go back to the breast every 1.5 to 2 hours. You're like, what is going on? And my breast feels soft. I don't understand. Maybe I don't have enough milk. We hear that. And that's not the case. The fullness that you have is not a determination of what you have inside of you. I can have a really small size A or B size cup breast and make, 5 ounces at each feed. Or I could have a size, 34 DD, right? Double D, and make only 2 ounces. It has nothing to do with the size of your breasts, of what you think.
I think that's a really important thing, because in my experience, so many women hear, oh, you need to supplement because you had a tiny baby. You need to supplement because you had a big baby. You need to supplement because you got little boobs. You need to because you got big boobs, right? And I always tell people, your body made this baby, right? You didn't go inside and help it. You didn't get involved in the process. You ate well, you took care of yourself, and your body did exactly what it's supposed to do. So if you have a big baby, like my younger son was 9'8" when he was born, so he was a big baby. Excuse me. And I made that baby, and of course I produced plenty of milk to feed that baby. And I just think it's breastfeeding, so much of it is in our head. Like, we just have to, like you said, get the knowledge and just realize and trust your body to do what it's supposed to do. Like, we don't think about digestion, and it happens. We don't think about, many things that happen in the body.
It's true. And but at the same time, with all that, if we are sending the signal to our body, if the baby is sending the signal to our body, then our body's going to understand that it needs milk. For instance, let's just say that your baby is taking in 3 ounces of milk, which is a normal amount of food at about 2 weeks of age.
Okay.
Taking about 3 ounces. And for whatever reason, your body had a slow start. Maybe you had extra fluids during birth and it slowed down, and so maybe your baby struggled at the breast. Maybe there was a tongue tie and it hadn't gotten released yet. Maybe there's all these maybes. We never know what those maybes are, right? But what we're doing is, when we put the baby to our breast and we only empty out 2 ounces, and the baby really needed 3 ounces, if we don't empty out 3 ounces or demand from our body 3 ounces, which would be either putting baby back to the breast to get a full feed, or backing it up with some pumping to send that message that we really do need a full feed, because our bodies work by demand, then the supply. So if we demand from our body what we need, or if our baby was having no troubles at the breast, they were breastfeeding all by themselves, they do the demanding. They do it all by themselves, which is how our bodies start to work normally. But when we hit a bump in the road, maybe it is a tongue tie, maybe it's just that we didn't know our baby needed a little bit more. And sometimes, we get mixed messages. But anyways, if we're not breastfeeding and we're pumping for some reason or another, we never, there's lots of reasons why people choose to pump. But if we don't put the demand on our breast to say, we're feeding this 1 baby, or we're feeding 2 babies, or we're feeding 3 babies, whatever that demand is, our bodies are going to respond to it in most cases. Right.
Sorry. And what would you say to the woman that is really fearful, like, my baby's not getting enough, and she's just kind of telling that to herself because the baby's eating so much? I just had a thought. It's kind of like, like they say, oh, it's just fooling around. He's not really eating. He's just kind of snacking. Like, he's using me as a pacifier. How do you address those types of questions?
When I get a chance to sit down with a mom in that situation, I teach them how to recognize what a transfer looks like. So I'm teaching her, is that baby a fast feeder? Does mom have a large volume? Because I work with lots of moms that can feed their baby in 10 minutes and
Mhm.
transfer 5 ounces.
Mhm.
So, and then the moms are thinking, but my baby is not on the breast long enough and they must be hungry, right? Why are they done in 10 minutes? What's wrong? What's the problem? And I say, well, let's look at it. And so we'll do like a pre and post feed weight transfer just to give her an idea of what is baby really doing at the breast.
Mhm.
So when we do a pre and post feed weight, what we are doing is we're checking the baby's weight, we're
Mhm.
feeding the baby, then we're weighing the baby again so that we can say, oh, the baby transferred 3 ounces in that amount of time. What's happening is when a baby eats super fast and they have a high suck need, because new babies have a very high suck need, they may want to go to the breast, but they may only want to pacify. They may not need to eat. And
Mhm.
so if they're saying, well, my baby's kind of playing around, not really wanting anything, I don't really know, he's not actively eating, but he'll lick my nipple or put his mouth on my nipple and just hang out, that might be just all it needs,
Mhm.
right? But we have to look at how satisfied is baby.
Right.
Is baby satisfied? You know, when moms have a large volume of milk and it's transferring fast, moms are putting it on their baby thinking that something's not right, you know?
Right. And that brings me to the topic that I is my pet peeve is timing in between, or taking the baby off, or manipulating time in any way for the baby. And it's really important that women just let the baby. And it's true what you're saying, because I know some people that shovel food down really fast. And I grew up with this girl, Kathy. She's the slowest eater in the world. Like, we're all different. And I know one side of my breast fed the boys really quickly and the other side didn't. They had to work at it. So just so everyone know that timing is up to the baby.
Yeah, it's true. But at the same time, that can also get dangerous. So if you don't know what is considered a normal time frame, so if your baby's eating every hour, there's something that's not quite right, unless they're going through a growth spurt. And a growth spurt lasts about 2 to 3 days. So they'll do frequent feeds for 2 to 3 days, and then they'll get back onto a normal pattern, which is normally 2.5 to 3 hours. And what I tell moms is, on a baby that's a little older, like around 2 weeks of age, for every ounce they take in, it takes about an hour to digest breast milk. So if baby's getting a full feed, they're going to be able to go a normal amount of time. If they're struggling and they're only taking an ounce at a time, then they're going to want to eat about every hour. That is telling us that there's something else going on. And oftentimes it's either a low supply because of whatever might be the reason, or the baby's struggling and just living off of like the letdowns.
Mm-hmm.
So the fast flow, because they can't work hard at it. So they just kind of peter out, and then they just eat every hour because they're just taking advantage of the easy flow, right? So every mom needs a lactation consultant, I think, at least one visit, just to see what's happening. How is things going? Oh, great. You're doing wonderful. Congratulations. This is what you might be looking for if you're starting to run into trouble. Or this is what you're going to look for. If everything is going well, you're going to see this, then you're going to see this. We kind of give them an understanding of what the whole relationship might look like.
Right. And how can they find a lactation consultant in their area?
Well, there is, well, of course, we have Google, right? We have Yelp. We have the La Leche League. We have breastfeeding support groups. We have the San Diego, like in our town, San Diego Breastfeeding Coalition has a list. So there'll be a breastfeeding coalition in your area that will have a list of practitioners.
Right, and they can probably just call their local hospital, right? I'm sure the
have a list. Their pediatrician might have a list. Everyone has a list, and a lot of times, if you work with a lactation consultant and you don't feel like you're getting your answers met, they may not have the answer for you, but it doesn't mean somebody doesn't have the answer. So I would say look for another lactation consultant, or find someone that's specializing in whatever complications you might have.
Right.
Yeah.
Right. All right. That's excellent information. I appreciate you being on the show today. Can you tell us, don't give it all away, but a little bit about your free gift that you have for our listeners?
Yes. So I have put together a ebook, an ebook that's called 9 Steps to Peaceful Breastfeeding. So it helps you look for proper alignment, maybe what transfer looks like, and just walks you through, maybe even some of the red flags to look for. It's really helpful. So it is for you. If you'd like it, reach out.
Yep, just click on the link below and you guys can gain access to this wonderful ebook full of information. Well, thank you so much. That's a wrap for today, and it's been so nice having you on the show.
Thank you. Thank you very much. Have a wonderful day.
All right, you too.
Thanks.